are reaching out to Dr. Mallika Marshall with your coronavirus questions, and tonight she's back with us to answer some of them. And Elsie's question is our first one. She writes, if you've had 2 vaccine doses but haven't gotten a booster, are you still considered fully vaccinated?
Yes.
Okay.
So far you are. If you have received 1 J&J vaccine or 2 doses of either the Pfizer or Moderna vaccine, yes, you are still considered fully vaccinated. That said, it is still advised that all adults get a booster at least 2 months after the J&J vaccine or 6 months after the second Pfizer or Moderna vaccine.
Okay, Debbie has a question. She writes, my son got COVID in January and lost his sense of smell with it. He says everything smells like vomit. Ugh, is that normal?
No, I know. I feel so bad.
I do too.
But you know, look, your son is not alone. There was a recent study in JAMA that found that up to 1.6 million Americans, and possibly many more, who've had COVID-19 had a change in their sense of taste and smell. And it's often lasted more than 6 months. It's not exactly clear why. And while experts say most people will recover their 2 senses of taste and smell, about 90%, some may not. So doctors are treating some patients with what they're calling smell retraining therapy, which exposes patients to certain odors to help them relearn how to recognize those things. So you can talk to your doctor about a referral to an ear, nose, and throat specialist.
And hopefully he gets that sense of smell and taste back.
For sure.
John writes, I just had COVID 4 weeks ago. I did not have the vaccine. Am I now immune from COVID because I have my own antibodies?
No. No.
We said that in unison. I'm like, I know your answer.
No. Yes. So of course you probably have developed some immunity to the coronavirus, but that immunity we know does decrease over time. And a recent study found that the immunity you developed after getting vaccinated is actually greater than that you develop after getting infected. Therefore, you should get vaccinated within 3 months of having your infection. If, however, you were treated with monoclonal antibodies, it's recommended you wait at least 90 days.
Okay, and our last question is from Robin, who asks, how soon after having a breakthrough case should I get a booster? Also, can I get a regular cold right after getting over COVID?
Yeah, so you can get your booster when you are no longer in isolation and you're feeling better. You can consult your own physician, but generally we recommend that you get your booster within 3 months of getting infected with COVID, unless, again, you've received these monoclonal antibodies, in which case you need to wait at least 90 days. And yes, you can still get the common cold and you can get the flu, even though you've had COVID and been vaccinated, so make sure you go out and get your flu shot.
All right, great advice as always. Doctor, thank you. Dr. Mallika offers her best advice, but as always, consult your personal doctor before you make any decisions about your health. If you have a question for Dr. Mallika, there are 3 ways to reach her. Email drmallika@cbs.com, on Twitter @Mallika Marshall, or you can Facebook message her, Dr. Mallika Marshall. David?
All right, Lisa, doctor, thank you.